Atrial fibrillation is an arrhythmia that involves the top part of the heart. The heart has two chambers. When they go into fibrillation, start to beat rapidly and uncontrollably, and can oftentimes cause patients to feel like their heart is racing and palpitations.
2.2 million Americans suffer from it, and the older you are, the higher the chances are that you may develop it. So here are some common questions answered. Number 1, what causes AFib?
Atrial fibrillation has multiple causes. Some people have lone atrial fibrillation, which has no known cause that we can tell, and they have no other medical problems. Many people that develop atrial fibrillation have underlying heart disease, they have hypertension, they have congestive heart failure, they have valvular heart disease. There are rare causes of atrial fibrillation which are genetic, and certainly as one gets older, the chance of developing atrial fibrillation is increased, and we know that age is a factor when it comes to atrial fibrillation.
Number 2, can AFib be cured?
Sometimes it's a matter of curing an underlying problem. Increase in thyroid hormone or hyperthyroidism can cause atrial fibrillation, and treatment of that problem can fix the arrhythmia. A pulmonary embolism or a blood clot that would go up into the lungs can cause atrial fibrillation. Treatment of that problem also can cure it. There are also medicines which can treat atrial fibrillation, not necessarily cure it. A series of different ablation procedures that are offered to patients which can result in a cure for atrial fibrillation.
Number 3, what's ablation?
Ablation is a way of cauterizing the areas of the heart that are responsible for starting the atrial arrhythmia.
Number 4, does AFib increase stroke risk?
Your risk of stroke increases with atrial fibrillation, and that risk is really determined, again, by what underlying heart disease do you have? Do you have hypertension? Do you have congestive heart failure? How old are you? Relates to your risk of stroke. Do you have diabetes? Have you had previous strokes?
And finally, number 5, what's my best protection against AFib? Can I prevent it?
So a lot of times you can't. As you get older and you have a higher chance of developing elevated blood pressures and hypertension or diabetes, you have a higher risk of developing atrial fibrillation. So all of the things that are recommended to prevent heart disease, weight loss, exercise, low sodium, low cholesterol diet are all important.
With Everyday Health, I'm Taryn Brill.